Welcome to this presentation by Warwickshire Pharmacy team, where we will talk about common medications used to treat people with lung conditions. In this presentation, we will mainly discuss inhaled medications and oral medications. We will go through what they do, why they are used, common side effects, and some advice surrounding the side effects. This slide shows a range of inhalers, but there are a lot more. There are over 100 inhalers and new ones are being continually released. Unfortunately, due to the wide range of inhalers, we will not be able to cover each individual inhaler specifically, but later we will share a website that can be used to see how each inhaler should be used. You can use this to check your technique. There are inhalers that need to be used every day, which are called maintenance inhalers. There are 3 main drugs that could be in these inhalers. These are corticosteroids, long-acting beta-2 agonists, or long-acting antimuscarinics. Corticosteroids work by reducing swelling in the airways and can reduce mucus. Long-acting beta-2 agonists work by relaxing the muscles that line the airways and opens them up. Long-acting antimuscarinics act on nerves and stop the muscles lining the airway from tightening and keeps them open. They also reduce mucus. You might be on one of these drugs in one inhaler, or a combination of these drugs in 2 or 3 inhalers. It depends on your condition and severity and the most suitable devices for your needs. It is generally important to take these inhalers regularly, even if you feel well, to help reduce symptoms, but also to help reduce the chance of a flare-up. You may not always feel the benefit, but they can actually prevent a flare-up from occurring in the long run. This is a table of some of the common inhalers and the drugs they include. You can try and find your inhaler and see which of the 3 main active drugs you are on. For example, if you are on a serotype inhaler, this includes a corticosteroid and a long-acting beta-2 agonist. Some inhalers are only used when needed, and these are called reliever inhalers. These tend to act quickly within 10 minutes, and the effects can last for up to 4 to 6 hours. These are called short-acting beta-2 agonists, and a common example is salbutamol. They work by relaxing muscles surrounding the airways, opening up the airways and making it easier to breathe. They are used when you are feeling more breathless, are experiencing chest tightness, and during flare-ups or exacerbations. There are many different types of inhalers. There's only a few main drugs used, but it's the devices and the combinations of drugs that means there are a wide range of inhalers. It is important that you are using the device or inhaler appropriately, so you are getting most of the medication into your lungs where it is needed and not losing the medication, so you are getting the most benefit from them and reducing the chance of side effects. There are different groups of devices, so you could be on a pressurised inhaler, breath-actuated inhaler, dry powder inhaler, or soft mist inhaler. Pressurised inhalers are sometimes known as a puffer or evohalers. When using these, you should not tilt the inhaler as you might lose the dose. To use them, it's a slow, steady breath in, so over 3 to 5 seconds, and then you hold your breath for 10 seconds, or if you can't hold your breath for that long, just as long as is comfortable for yourself. It can be difficult to coordinate these inhalers, and spacers can help ease this. With breath-actuated inhalers, such as Easy Breathe or autohalers, these should also not be tilted, and it's a slow and steady breath in, and then hold your breath as with the pressurised inhalers. For dry powder inhalers, such as AccuHalers or capsule inhalers, these should not be tilted, inverted or shaken, except for Spiromax and turbohalers, which can be shaken. It's also important to not breathe out into the inhaler as you can lose the dose. For capsule inhalers, the capsule should not be pierced more than once, as this can shatter the capsule and can lead to you breathing in the small fragments. With these, it's a quick and deep breath in, and then you hold your breath for 10 seconds or as long as comfortable. Soft mist inhalers, such as Respimat, should be breathed in slowly and steadily, and then once again holding your breath. With these inhalers, they may come with a cartridge that will need to be inserted into the inhaler before use. You will also need to release some doses to the ground until a cloud is visible, then release 3 more doses, then the inhaler is ready to use. This is called priming the inhaler, and it is essentially getting the inhaler ready to use. If you have not used the inhaler for 7 days, then when you restart it, you will need to re-prime the inhaler, but with 1 puff towards the ground. If it has been 21 days, you will need to release 3 puffs to the ground. This link shown is for the Right Breathe website. This is very useful. It has videos for most inhalers showing you how to use them. It is always good to be reminded of how to use your inhaler so we can check we are using them correctly. If you are not sure, you can be observed when you have your next review with a healthcare professional or visit your community pharmacy. When you are on the website, click on the inhaler diagram, search for your inhaler, and you should be able to watch a video of how to use the inhaler. It's important to remember that side effects will not always occur, they are just a possibility. We're all different, so some of us might get side effects that others would not. It's good to be aware of the possibilities so that if you do experience them, you know what it could be, and if they are troublesome, you can seek advice. Generally with inhalers, you are receiving low doses of the drug and so the side effects are mild. With corticosteroids, you could experience a sore throat, hoarse voice, or oral thrush. But if you're on high doses, especially for a long time, it can lead to diabetes or cataracts. With certain inhalers, you can use spacers, and these can help reduce side effects by getting more drug to the lungs where it's needed and less in your mouth or stomach. Rinsing your mouth with water after using steroid inhalers or using your inhaler before meals can also help reduce the chances of getting oral thrush. With long-acting and short-acting beta-2 agonists, side effects could include feeling shaky or the heart beating faster. With long-acting antimuscarinics, you might experience a dry mouth, nausea, or the heart beating faster. Mucolytics are drugs that help clear mucus. Mucus can attract bacteria and potentially increase the risk of infection. Carbocisteine works by breaking down mucus so that it is thinner and can be cleared. Side effects can include an upset stomach. Nebulized saline can also be used, which is salty water that is inhaled. The salt draws water into the airways and thins the mucus. Montelukast works by reducing secretion of mucus. Side effects can include abdominal pain, thirst, or headaches. It should usually be taken in the evening. You might have rescue medication for when your symptoms get worse if you are having a flare-up. This usually includes a steroid and/or an antibiotic. If you feel more breathless than usual, but you have no fever and your sputum is normal for you, the first step is usually to use your reliever inhaler more. Many milder flare-ups will respond to this. The steroid is started when your symptoms have not been controlled by using your reliever inhaler or if your symptoms are severe. You might be experiencing increased breathlessness, wheeziness, new or increased chest tightness, and/or a new or increased cough. The antibiotic should only be started if you have a change in the amount and consistency of sputum, and if there is a change in colour to a dark yellow or green, which indicates you could have an infection. If your symptoms feel different or more severe from your usual exacerbation, then taking the rescue pack may not be the right thing to do, and you should also call for help from your community respiratory team or GP. Short courses are unlikely to cause side effects or might be minimal. Ensure you are taking the right dose and the courses as instructed, and only when you need them for flare-ups to reduce the likelihood of side effects and resistance of antibiotics. Always tell your GP if you've started them. If you start a course of antibiotics, you should complete the course even if you start to feel better. This is to reduce the chance of antimicrobial resistance. This diagram illustrates when rescue medication should be started. If you are more out of breath, use your reliever inhaler. If you are more out of breath despite using your reliever inhaler, start the rescue steroids. If there is a change in colour of the phlegm to dark yellow or green, take the rescue steroids and antibiotic. The potential side effects from steroids include osteoporosis, which is weakening of the bones. Exercise and eating foods rich in calcium and vitamin D, such as leafy green vegetables, dried fruit, yogurt, tofu, eggs, milk, and oily fish, and avoiding too much alcohol can help reduce the risk. You may also be given medication to help strengthen your bones if needed. Other side effects include increased appetite, difficulty sleeping, diabetes, thin skin that bruises easily, cataracts, and severe mood changes. It is important to stick to the courses as instructed. You might be on them long term, but usually the lowest effective dose is used and you should be monitored for side effects. If you are experiencing any troubling side effects, please speak to your GP or healthcare professional looking after you. If you have experienced a number of infective flare-ups, you might be on long-term antibiotics to try and prevent infections from occurring. These are called prophylactic antibiotics and are taken regularly. It can include azithromycin, which is usually taken 3 times a week, or colimycin nebules. Some antibiotics are used to treat an infection when it occurs. Treatment options include amoxicillin, coamoxiclav, clarithromycin, or doxycycline, but others can be used. If you have a penicillin allergy, you should not have amoxicillin or coamoxiclav. If you have doxycycline, you should avoid indigestion remedies or medicines containing iron or zinc 2 hours before or after you take this medicine. You should also protect your skin from sunlight, even on a bright but cloudy day, by using sun protection. If you are treated with clarithromycin and are on a statin, you should hold the statin whilst you're on the antibiotic. Remember, if you are taking an antibiotic to treat an infection, you should complete the course. It is not completely clear how Theophylline works, but it seems to reduce swelling in the airways and relax the muscles lining the airways and open them up. It is important to have correct levels in your blood. Too low and you may not be getting the full benefits of the medication. Too high and the medication can be toxic. Therefore, blood levels are taken. These are checked after 5 to 7 days of starting the medication and after any dose changes. Side effects can include nausea, headache, sleeping difficulties, and upset stomachs. Signs of if the levels are too high could include vomiting, increased or rapid heart rates, restlessness, or agitation. If you experience any of these symptoms, it is important to seek help. The levels can be affected by smoking, medications you can buy such as St. John's wort, or alcohol, so please discuss this with your doctors. In summary, please make sure you check how and when to take your medication and inhalers to get the most out of these medicines. If you experience any issues, please discuss these with your doctors or nurses, as there might be alternative medicines or ways that they can help.